That there are our state, which has, as our whip has often said, we've already had 25,000 plus folk contract this virus. Over 1,000 people died. In our neighboring state of Alabama, 6,500 people have contracted the virus and 350 souls have lost their lives. And they have one of the most strictest shelter in place options in the United States. So our neighboring states are being affected by the decisions that we're making here in Georgia. We are the #1 state to be business, but we want to do business in a responsible way. We want to make sure that our people are safe. And if we look at this problem as an adaptive leadership problem, and we see that we're dealing with a virus, a killer of humankind, if we harness our energy and deal with this virus as such, we can get through it. Now, we know we have economic problems. The virus has unearthed some interesting things. One is we look at healthcare disparities across our state. Yes, the virus has shown that. It has shown that the weak, those folk who are most vulnerable, who live in these areas in our state that don't have access to healthcare, who live next to trash heaps, quite frankly, are going to be more susceptible to have a problem. It's unearthed something in our university system, where there are kids today in rural Georgia who don't have Wi-Fi. We have to go to restaurants or parking lots to try to do their homework, and it's not right. And so, yes, this virus has unearthed some really interesting problems in the state of Georgia, but it's not a school problem. And although those students absolutely should have an opt-in option for pass-fail, that's not the issue. The issue is we're dealing with a scientific problem, and we must treat it as such. And so we're asking the governor to do is to maintain a shelter in place, change your course, and start to move in a direction that respects science. We can take care of the economics, we can take care of the schools, we can fight about the disparities that we have in our healthcare system, but we can't do that if we're not alive. And so I would call on the governor and those who are in current leadership to reconsider your actions. Today, the General Assembly received a note from the Speaker of the House that we'll be returning, it looks like we'll be returning sometime in June. It's tentative. But I would ask the Speaker to reconsider that as well, especially as it relates to the workers who have to come in before us. We are citizen legislators. Those workers, this is their lifestyle. To have them come in 2 weeks prior to us, I believe is ill-advised. So I ask you to reconsider that in the most urgent of ways. As we move forward, there are some resources that I want to let the state know and that our members are aware of. And that is that $50 million through the CARES Act have been given to the state to actually be used in about 25 counties throughout the state for COVID relief. And at the end of this video presentation, we will certainly put that out so that you'll know what money is available for potential PPE, for testing, and for treatment if you need it. And although the treatment is sketchy at best, there are some options that you do have, and so we want to make sure that you have those resources available. At this particular time, I'm going to turn it back over to you, Vice Chair, and we need to, I guess, take some questions from the media. But the message today is simple. Stay home, stay safe, and take care of one another. Vice Chair, I turn it back to you. You're on mute.
Thank you so much, Chairman. I'm going to go ahead and start with the questions that we have already received. The first question that we have is, what would you say to Georgians that are going to go to the malls and to the shopping centers despite our warnings? And I'm going to take this question, I'm going to give it over to Representative Rhonda Bernal.
Thank you. We know that you have to go out, but we also want you to be safe. Make sure that you have put together a COVID-19 family toolkit that contains masks and gloves for every family member and hand sanitizer. When you exit your house, make sure everyone has their masks and gloves on. As a retired educator, I know that children love to touch items. Make sure your children have on gloves and that you talk to them about not touching items and putting their fingers on their face or in their mouth while you're out. On the average, it has been observed that children touch their faces 23 times per hour. We care about you and want you to be safe and make good decisions. Remember, we are here for you.
Thank you so much for that, Representative Arnaud. So the next question that we have is, can you explain why elected leaders think that it's okay to return to business as usual? I'm going to direct that question at Representative Angelique Kosh.
Thank you, Vice Chair. So I'm very cautious with going back to business as usual, and here's why. My husband and I both had COVID-19, but the experience for both of us was very different. My husband exhibited symptoms around mid-March, a dry cough, fever, weakness, and initially he thought it was just a common cold, but we quickly realized that this was probably coronavirus. He had been traveling internationally, got tested quickly, which confirmed that it was COVID-19. Our mindset was, well, we're healthy, we eat well, we exercise, this will pass quickly, but it didn't, at least not for my husband. He was sick for 3 weeks. I only had it for a few days. He had a fever for 15 days, and that is a very long time to have a fever. He described that he was feeling awful, but stable awful most of the time. But we didn't know when it was going to get better. When we talked to our doctor about the differences in our experiences, our doctor said that at this point, we simply do not know enough about COVID-19. We do not have enough research. Personally, I can tell you that I do not want anybody to go through what my husband went through, and I just can imagine how scary this disease is for those who get even sicker than my husband. And to our decision makers, if you have not experienced this disease up close and personal like we have, please keep in mind that as long as we do not know who is going to die and who is going to be fine, as long as we don't have a treatment and vaccine, we should be cautious. And right now, we should continue to shelter at home. Thank you.
Thank you so much, Representative. And we are so happy that you all were able to get through this. We have one more question. It says, given some of the things that we've seen out of the governor and leadership shown by the counties and city governments, how are cities and counties assisting the small businesses and the underserved population that they govern? And we're going to take that over to Representative Donna McLeod.
Thank you, Representative Thomas. So the governor says, open up the barbershops and the beauty shop. What he doesn't tell you that you are responsible for your own PPEs. He says, open up the movie theater. What he doesn't tell you is that your obituary could be the last scene. And what he doesn't tell you about opening up the malls, yeah, go ahead, shop until your heart's content. But know this, that your lungs could pay the ultimate price. I'm grateful to the cities and the counties for stepping up. They have really done a good job in stepping up for us. And they are using pockets of their money to make sure that they are serving the underserved and our small businesses. There are several pockets of money in our counties that we want you to be aware of, like the Home First, that is for homelessness and for our medical clinics. The community development block grants, those that can be used for housing and for other community needs. The emergency funding that is awarded to nonprofit organizations. Again, a lot of folks do use nonprofits to get assistance. The aging program grants, which allows for our counties to feed our elderly folks. And of course, in my county, we were awarded over $163 million in Gwinnett County. And I have spoken to the chairwoman of the county, and a lot of that money will be used to assist the county, of course, in fighting COVID, but we are also looking to make sure that we are going to help serve the underserved and also with these small businesses. So I'm very grateful to the county and cities for stepping up, and I'm asking everyone to stay safe and be aware that this is going to be a lot of your decision making as well. So thank you so much.
Thank you so much for that, Representative Donna McLeod. We're going to take one last question from the media, and we have it from Richard Elliott from WSB. And he says, the governor was able to extend a portion of the shelter in place for medically fragile people. in order to prevent local governments from reissuing their own shelter-in-place orders. Do you believe that local governments ought to be able to issue their own orders and guidelines? I am going to kick that over to our chairman, if he can go ahead and answer that question for us.
Thank you, Vice Chair. Yes, we certainly believe in local control and that the local government has the best feel for what's happening on the ground. And for the governor to issue the executive order and be explicit about how we should handle the state when there are different ways in which the state, local governments do what they do. We talk about local control all the time in the General Assembly. There's never a day that goes by that someone's not talking about local control. Right now is the time to exercise the local control at the ultimate levels where people can actually do what they need to do where they are. So yes, we certainly think that local control should be the rule of the day until the degree that local control actually goes beyond and puts people in harm's way. So the beaches and stuff like that, when the government sees there's a problem, then yes, we may need to take a look at that. But as long as local control is bringing people into safety, then we need to let the local government decide what they do.
Thank you so much for that, Representative and Dr. James Beverly. Can you please go ahead and close us out for our press briefing?
Thank you, Vice Chair. Listen, we find ourselves in difficult times, as we know. The data is confusing at best. The DPH website said on Monday there were 323 people who contracted COVID. The next day there were 920. The next day there was somewhere around 500. Then there were 620. We're still in the first wave of this virus. It hasn't ended yet. We haven't even begun to crest. We don't know what science is saying right now. What we do know is that it's not time to go out. Please let science guide our decisions as we move forward. This is an adaptive leadership problem that we pull together, and every stakeholder has a chance to answer the question on how we eradicate this real enemy. We'll fix it. So in conclusion, I would just say to the state of Georgia and to our members and to people at home, it is too soon to go out. Stay home, stay safe, and protect your family. Thank you. And if you don't mind, Representative Erica Thomas, Vice Chair, is that we will have another press briefing on next Thursday at 1 o'clock. I think there were some technical difficulties with Facebook today, or some linkages, and we will work those out, and we will place this on our Facebook page at 1:30. So thank you guys for joining, and y'all stay safe, and we'll see you soon.